All right, so for your IV piggyback and IV primary checkoff, you're gonna check your MAR, do your 6 rights. So your 6 rights are patient, medication, dose, route, time. 6th is your documentation. All right, how many times are you checking your MAR? 3 times. When are you doing that? When you get your order, when you pull up your med, right before you give it to your patient. Know those 3 times for your checkoff. All right, you're gonna look up your medication. We're gonna give you a card so you'll know exactly what you're looking for. We'll tell you what supplies to have. Calculate your drip rates for your primary. We'll just give it to you. Your primary, let's say it's at 75 mLs per hour. Make sure you have the right bag for this. You pull your IV tubing out of your bag. And remember, there's that perforation on the side. You're just gonna rip it open. So when you have your primary tubing, what's the first thing you do when you pull it out of your bag? Very first thing, you're gonna lock it. So you pulled your roller clamp, put it all the way to the bottom. This takes a little bit of pushing, so you can play around with that. Remember, with this little blue tab, you're gonna put that up towards the top. Sometimes it's clear at the bottom. Put it up towards the top so you can thread it through your IV pump. You're gonna take your IV bag, take off your cover to your, where you're gonna spike it. You're gonna pop this off if it's not already on there, and then you're gonna push and twist to prime it, or to spike it. This is locked, so you can flip it upside down now. You're gonna hang it on your IV pole. What's the next thing you do?
Prime it. Squeeze.
You're gonna fill your chamber up to this line, or you can go a little over. And then you're gonna prime it. So you have your trash can close by. You're gonna slowly open up your lock. Watch where it comes down. Sometimes if you've used tubing before, it takes a minute to get it to go. Make sure everything's unlocked and get your fluid to go all the way through. Sometimes you have to squeeze it again. Sometimes I have to take the cap off and then it'll start to flow. If you're using tubing that's been used before and you can't get it, just tell how you'd prime it. Remember how I usually flip this upside down and get the air out. This one's not gonna prime, so this video is gonna be fantastic. All right, you're gonna start your pump. So, well, before you start your pump, you're gonna put your tubing through here. Remember, the opening, the little hole is what goes into your pump first. So you have this little slit in the bottom. You're gonna fish that in there, push it all the way in till it clicks, and then fish your tubing all the way up and around. If I can get it. And then you shut your door, your click, latch, and shut it. Then you're gonna turn on your pump, and you would have your cap on. If for some reason your cap comes off and this touches things, what are you gonna do before you insert it in your patient? Yeah, you're gonna have your alcohol, you're gonna clean it. So what did we say our primary rate was? 75. What's our primary volume to be infused?
100 or 2,000 or I'm just guessing.
1,000. So 1,000 is our rate. And I'm gonna go ahead and, or our volume to be infused. I'm gonna go ahead and start it. Why isn't it going, do you think?
Air bubbles.
You have air all through it, and what else did I forget to do?
Unlocked.
So it's locked. Good. So make sure everything's unlocked before you start it, because that will obviously occlude it to your patient. Before you hook it up to your patient, what are you doing with the head block? Cleaning the site, flush with 3 mLs. Remember? And then you're hooking it up, pressing start. Trash can is my patient. Now you're gonna do the secondary bag. Make sure you have the right order. You're gonna do your 6 rights again. You get your secondary tubing. Open this up. Remember what we do with our clip. What's this go on? The primary, yeah. So you're gonna go ahead, hang this up on your IV pole. Don't get it all tangled. Whenever I try to go fast, that's when I mess everything up. Look at that. Okay, and then hang your primary so it's lower, because remember you want your secondary to drip first. Then you have your primary, your secondary tubing. What do you do first? Lock it. I'm gonna bring this up higher. So this is already locked. I'm gonna make sure I have the correct medication, and then take off your blue port if you have it, spike your bag. Then you're locked, so you can flip this upside down, hang it, before you plug this into your primary, what are you gonna do? You're gonna wipe this off with an alcohol pad. Remember, you push and then push it down and twist it in. So you're gonna have to mess around with that. Then you're gonna unlock your bag. Remember how you reverse prime it? Take this off, take it below the level of the primary bag, so it primes up that tubing. That's on your test off. Put it back up here, then you're gonna prime your secondary rate. What did we say our secondary rate was? If you want the 100 ml bag to go over a half hour?
200.
200, so our rate's 200. Our volume to be infused is 100. And then you hit secondary start. But it's obviously not gonna work for this one. But if, when you're checking off, even if your pump isn't working at all, you're gonna say you wait until you see the drip to make sure it's going. Check your patient, make sure they're tolerating well. What are you looking for in your patient? Redness, infiltration. If they say they're uncomfortable, and then you're getting rid of all your supplies, and then what's the very last thing that you do?
You watch it to make sure it drips, then there's no reaction.
And then you document. Yes, good. Okay, you can stop it.